Hey everybody, David Kemp here, host of Highway to Health podcast. And as always, thank you for being here. And I hope you've really enjoyed previous episodes. I know I have. And you'll like this one today too. You know, something we've all heard a lot about. There's been a lot of buzz, really for the last 10 years. And it's about value-based care and what that means for our providers, what it means for the payers, what it means for the patients. It's all great in theory, right? So I don't know much about it and want to know more. How is this going to be applied? What's the reality? Where are we now? And that's why I'm so excited to have Matt Molsky, CEO, founder of TELUS Health Solutions, on the call today. And we'll get his take on where we are in this open road journey to improve healthcare experience, healthcare outcomes, access to care, and what needs to be done, what's currently being done to make value-based care a reality and feasible for our entire community. So Matt Molsky, welcome to Highway to Health.
Yeah, man. Thanks for having me. Excited for the conversation.
Yeah, how you been?
I've been great. Just busy. A lot going on. Coming towards the end of the year, a lot of clients trying to figure out what's going on with this final rule, which will come out here in the next couple of weeks. So just we've been working pretty hard at just everything that's going on.
Yeah, I bet it never stops changing. That's one truth about healthcare. We'll get into work here in just a minute, but let our listeners know a little bit about yourself. You've got a pretty cool background. Tell us a little bit about how you got to TELUS Health Solutions, and tell us a little bit about what you enjoy doing outside of work. One thing that I like to ask, especially our executive leaders that join the show, is what are some of the things that you do outside of work to maintain a good balance, a mental stability, a mental focus, and then keep your body healthy too with your busy schedule. I'm sure that's a challenge. So if you feel comfortable, tell us a little bit about what you do outside of work to maintain a mental and physical health.
All right, let me start with work. Some of my background that led up to TELUS, I worked at 3 different startups over a course of 8 years in the post-acute space, primarily in the technology aspect of things. So that's really what I guess started TELUS and what got us where we're at right now. We launched as an RPM company. We've made a little bit of a pivot and are doing something really unique in just the home health space in general now. And then personally, always try to make sure that I'm getting into the gym, taking care of myself at least a couple times a week. I grew up in a military family, so I've got, we traveled all the time. So I've got friends and family all over the country. So try to make time to just get out and see them when possible. Obviously, we've been super swamped, so hasn't been so much the case as of late. But I guess for fun, we like to play a lot of golf when I can. Schedule doesn't allow it as much anymore, but it's something that I really enjoy. I got a 1-year-old golden retriever that keeps me pretty busy as well outside of work. So outside of that, I think one of the biggest, we could probably sit here and talk about, mental health of founders and so forth for hours of just different things that, trials and tribulations of building a business. But that's what I try to keep myself in check.
Yeah, it's important. It's never easy. I heard somebody just yesterday tell me it's not necessarily balanced all the time. It's not like 50% of their day is work and the same day that other 50% is personal. But what you've got to do is stay self-aware. And when you feel yourself getting burned out, you've got to take some time away to refresh and stay sharp. And so it's almost impossible to maintain a balance every day, all the time, but staying connected to what you need personally is important. And we'll have to go out and play some golf sometime. The 1-year-old golden retriever, man, that'll keep you busier than anything else.
Yeah, for sure. He's awesome. He's a lot of fun. He's sitting outside of my office right now, staring at me. He's cool. Pretty laid back dog, but definitely helps force me to pull myself away from everything that's going on and just get outside in the middle of the day at times, right? Just take a walk. So he's been awesome. Great addition to the family.
Yeah, absolutely. They always are. Set the stage for our listeners. You mentioned being a part of a couple different startups, and you had your ear to the ground in the healthcare industry in a lot of ways. tell us what you're seeing in the industry right now, the trends that you're seeing, and then specifically in the value-based care space, what opportunities and challenges get you excited about how we might have an opportunity to make an impact, in the overall healthcare community in the near future?
I would say, yeah, that's one of the big challenges, right? It's a mindset shift. So what we're seeing on our side is organizations that are really trying to figure out not so much a way to, obviously they want to maximize revenue, but they're really trying to figure out a way to reduce the total cost of care delivery, right? So, I think that hits on that triple aim aspect of care, right? And what value-based care is really all about, making sure that patients have a great experience and are satisfied, their outcomes are improving, your providers are not extremely burnt out, and at the end of the day, the cost of care delivery is being reduced. So that's what we're seeing a lot of right now.
Yeah, and this has been a topic for a long time. I mean, you and I have been in healthcare for over a decade now. It's been a topic since we started. But we're starting to see some real momentum now and some real action take place in this space. As of a few years ago, it was really an idea. It was a way. It was an idea that might be out into the future that we would get there eventually. But we're actually starting to see it put into practice and see some action taken on value-based care. In your specific sub-vertical or sub-industry of healthcare, you're starting to get, some of the first experience with the implementation of a value-based care, model. So, why, outside of that, why did it take so long to get here, and what was the compelling event to actually see some action and some implementation of these models being put in place?
Yeah, specifically in the space that we serve, a lot of change is obviously, it starts with regulation, policy, and payer, right? So CMS kind of drives a lot of that initiative, if you will. So, like I said, back in 2020, home health agencies moved to a full bundle payment model with PDGM. And so just going into effect next year, we've got what's called value-based purchasing, where home health care organizations can gain or lose up to 5% of their following year's revenue based off of the performance scores. So it's comparing the 2023 scores to 2022 in most situations. So, how well were they able to improve patient outcomes, keep patients out of the hospital, and what were their satisfaction scores based on patient surveys? And they create a calculation and call it the normalized score. And then they're comparing that. So the agency is looking at, what their scores are next year versus what their scores are this year. And then comparing those to others within their cohort, so other organizations of equal size, and that's really driving a lot of that too. If you take into consideration that the industry that we serve and we work with, they're operating on a 3 to 5% profit margin in most situations, somewhere in there, and that's a pretty big hit. So it's really starting to drive and force providers and the providers want to be transparent across the organization as far as this is how we have to make some of these changes, but looking for solutions to do so in an effective way that's still going to drive outcomes, still reduce some of the burden of their staff, and also be financially viable to where they keep their doors open.
Yeah. And that would be my assumption too, in a lot of ways. And it's good to actually hear you confirm some of these things. I would anticipate there's a significant amount of infrastructure that needs to be put in place for providers to deliver this kind of care to their patient community, whether it's staffing, technology, analytics, consulting and guidance from an outside source. There's probably a lot of infrastructure that those providers need in place before they can really start delivering. Tell us what you've seen in the marketplace and in the industry on how certain providers are starting to gear up and put that infrastructure into place.
Yeah, I think a lot of it's education, right? Everybody's got to be on the same page. And that's not just at the provider level. I think that's at the payer level as well. We're seeing right now, the final rule hasn't been released yet, but providers are and really the industry as a whole is really trying to go back and be like, all right, CMS, you really need to look at this, once again, because this is going to really not necessarily accomplish what exactly it is that you're looking for, because they're looking, CMS is at this point in time proposing a pretty significant payment reduction for next year, right? And so, as patients want care at the home more, like care at home is where patients want care. So if you're looking at just all of the different variables, right? You have a growing or increasing size of the patient population, which our clients serve, or a very limited and burned out workforce, of clinicians. So your supply and demand is already, there's already way more demand than what there is supply. And then then they're proposing to reduce, total number of the total payment going into the next year. And that just creates a really, really big challenge. So I think more from a infrastructure perspective, obviously there's a lot of education that needs to happen. And there's got to be some sort of change as far as like how the entire operation model works. And that's kind of what, TELUS is trying to assist with as far as looking at data and insights and providing additional information to these providers by connecting with patients virtually, not providing care, but providing updates back to those clients so they can make better decisions with actionable insights.
Yeah, that might be one of the really exciting side effects or outcomes of this value-based model is it's going to force everybody to communicate. And it's going to force some transparency from the patient, so that the provider has the right information, so that the payer has the right data from the provider and the patient. And then, we use this term a lot on this podcast, it taking a village, so everybody to be involved to make this a success for everybody, not just one side or the other. Talk a little bit about how we can start bringing those different systems together, the patient, the provider, and the payer. How can we break down some of those walls so that we're all working together towards the same goal or a similar goal?
Yeah, I mean, I think that's, the billion-dollar question, right? As far as interoperability, and, there's so many people out there that have been trying to work on interoperability for so long. And then you have, again, going back to the workforce, just a very, very short-handed workforce. And people coming and going and moving, transitioning jobs in and out, from provider to provider. So it becomes a really, really challenging and complex process due to regulation, right? So like HIPAA makes this a very, very difficult process, which is it's a necessity. But at the end of the day, like regulations and rules make a lot of that a really complex and difficult challenge. So, I think one thing one thing we're seeing CMS do is start to actually, showcase and forecast, or not forecast, but produce different measures and outcome measures, satisfaction measures publicly so that others can see it. Right now, the information's in the rear. So I think, one of the areas that could help, like in the short term, as until we figure out this whole interoperability thing as an industry, is just keeping that up, but making it a little bit more real time, so others have an understanding of what actually is going on throughout the rest of their industry. Like, where are the standards and where's the industry sitting at right now, so that it can be a little bit more actionable. I think in healthcare you're always looking backwards to try to figure out what you're going to do forward, moving forward. But if there's like one thing that I think could really make an impact sooner rather than later is just getting a little bit more real time, as far as and real time is not the right word, but a little more near time as far as the data and the outcomes and the information that's being collected at the payer level, to make some of these different financial decisions. So, we can really know where to focus more, but they're making decisions at.
I'm going to put you on the spot here, and I don't mean to, but I'm confident that you've got a good answer for this. In the ideal state of value-based models, what's in it for the provider?
Yeah, I mean, I think, if you're looking at the patient care, right, and their patients are getting better, I think that's actually a really hard question. What's in it for the provider? There's the opportunity to reduce the total amount of care and delivery of care, right? It just depends on the model, though, right? I mean, that's actually really the answer is it really depends on the payment and the financial model when you say value-based care, right? So if you look at it from an individual provider level, there's an opportunity if it's on the bundled payment model and they can still deliver care at a high quality level, produce the outcomes, produce the patient satisfaction, reduce their burnout amongst their staff, and not necessarily have to deliver as much care, but it's more focused and quality care. I mean, I think there's an opportunity, a huge opportunity there, because they can still get that full aggregated payment, but they're not necessarily, and then deliver care, the time that was spent outside of that, in yesterday's model, to see other patients. I mean, I think that's a bigger opportunity there. But that's a loaded question, because it really just depends on how the model's put together.
Yeah, I agree. I mean, I think ideally, if we're taking better care of the patient, they're staying healthier and avoiding, some of these more complex healthcare events or episodes, the level of care, the level of service that you have to provide is more, of a maintenance type of care instead of these big episodes and big events. So that probably keeps the cost of care down a little bit and would allow you as a provider to work at a bigger scale, at a wider scale. But just from the conversations you and I've had today, and then, what we know in the market, it feels like there's a long ramp ahead, because now you're talking about changing behaviors of the patient, which we've seen is really hard to do, to get them to adhere to a plan, especially when they're not under the supervision of a provider or a clinician, when they're at home. Do you see that the adherence of a treatment or of a therapy when that patient at home as being one of the main risks with a value-based care model?
Yeah. I mean, so it all really derives, is a derivative of patient engagement in their own healthcare, right? And taking account for their own healthcare. I mean, I think that's a very big challenge that you see across all areas of healthcare. I mean, even probably inside of a facility, right? I mean, if patient's not willing to do what is necessary to get themselves better, I mean, you can't help somebody that doesn't want help in some form or fashion. But I think there's also like a big knowledge gap as far as like what patients understand what needs to happen versus what is actually happening, right? And as you have a workforce that's continued to, just be like shorthanded, they're burnt out, it becomes really difficult, I think, to educate in addition, further education, in addition to just providing that care. I mean, I think there's some really good stuff out there for that we've seen for like the primary care space, CCM is a great program that's out there that, they're doing some of that engagement outside of just when the patient's coming in to visit physicians in the office. And Gooden is a company that's out there. And we've spoke with them before. They do an awesome job. And just, making sure that patient has an additional touch point or two, and has different areas of what their care needs are met. So I think that's an awesome program that Medicare's rolled out, for that primary care space. Primarily from like, I guess where we're trying to work, the area that tele services, our clients are seeing their patients a couple times throughout the course of a week, 3 to maybe once a week, throughout a 60-day period. So they're in the home, but they're working with a lot higher acuity patients. So I think part of the challenge there is actually like communication in that space, right? The total number of patients that want care at home is far surpassed like the total number of clinicians that actually deliver care at home, across the country. So if you think about it from just how the industry kind of the landscape there, nurses are going out and visiting these patients in the home. They've got one of the hardest jobs I think there is out there. You got clinical managers that are trying to do their best to really navigate like the patients that need care on specific days. It's really unique space. The one in home care is a really unique space. And so I think one of the big challenges that like we're seeing with a lot of our clients is, it's the engagement piece, but it's also the ability to make, decisions based off of information, because things are always changing, especially with your higher acuity patients, and apply focus to those patients that are maybe not rehabilitating as fast as that are as planned within their care plan. And so because of how a lot of technology is developed today, especially like within your EMRs and so forth, there's not really a great way to understand where things are at across the scope of a patient's care as it progresses.
Yeah, and I think you're touching on a subject where we've seen a ton of innovation, which is remote patient monitoring. There's been a ton of innovation over the last 10 years on how we can keep tabs on patients that are outside of a hospital setting. That probably plays a big part in home health, and then this move to a value-based model as well.
Yeah, I mean, I think RPM in the traditional sense of getting vital signs and monitoring and so forth, for the space that we serve, it's great for some patients, but it's not applicable for all. The cost is, like I mentioned earlier, you're working with a group of providers that have a 2 to 5% profit margin. So adding something on top of that makes it pretty challenging, right? So it's got to be really cost efficient, and then it's got to be super simple for the patients. So you have a patient that's 90, 95 years old that gets discharged from a hospital, and you're asking them to use all this equipment and answer all these questions inside of a tablet. That becomes really, really difficult. So I think RPM is an amazing opportunity. There's tons and tons of different innovation, and it will without question be a necessity inside of value-based care, at large. I think we've just seen some different challenges with groups that are specifically in the home healthcare space, rolling that out effectively across, all applicable patient populations. Because when you really think, I guess one other thing is you have to take into account the human factor of, you have nurses now that are going to have to take the equipment. You got to go back and get it, it's got to be sanitized. So there's just some other challenges, but there's obviously a huge opportunity there.
Yeah, it's and new models like this, challenges are all over the place, and we can usually put our fingers on the big ones and think of ideas on how to solve them or address those challenges. But sometimes when you solve one of those challenges, you create a series of downstream effects. Remote patient monitoring is important because now you're getting that information back from the patient. But now it's a bunch of information. It's a bunch of data that you then need to analyze, and you need talent to do that. You need people to do that. And we've already talked about how it's so hard to find the talent and then retain the talent in these roles. So you have to pay them more, and that hurts your margins a little bit. And so just the amount of data that your providers are having to work through to make this a possibility and a reality has got to be, almost overbearing and really burdensome for those providers.
Yeah, I mean, one of our key focuses is always to really make sure that we're reducing the noise of anything that could be overbearing. I mean, I think across healthcare in general, providers are inundated with data, right? It's coming from everywhere. So in order for it to be actionable, and it's not like death by a million mosquito bites or just white noise at some point in time, right? It's got to be actionable, and it's got to be delivered in the right form and fashion. And it's got to be ever changing, right? Just how you're delivering that information, how it's being reported. It changes pretty frequently. Year after year, you have different, things that come out in the proposed payment. You have policy changes. At the core, the data is really, really, really helpful and insightful. But at the surface level, it just can't be just thrown at them, I would say would be the best way to put it. I mean, the Journal of American Medical Association actually just put out an article earlier, I think it was last month, at the end of last month, that said that 50% of patient notes, visit notes, are copy and pasted. Wow. So now you have a bunch of information that is also potentially not even actionable or accurate, right? So it's how can you make decisions based off of that information? And that becomes another challenge of its own.
Yeah, no doubt. You touched on something at the very beginning of the podcast. The final rule that's set to come out in a few weeks. What do you know about the rule? What are you anticipating? And for the providers that are listening and the other listeners that are interested, give us your take on what you know so far about that final rule that's just a few weeks out.
Yeah, I mean, it's a reduction in payment is the big thing that providers are really, really worried about. I mean, I think things are coming to a crawl as far as what all is, what's going to be the action items going into 2023, because there's so much uncertainty, right? There's still a lot of change coming down the pike with value-based purchasing, which is a new initiative, like I mentioned, it's going into effect in 2023. But I mean, that's the big thing, right? Is that providers are, there's a lot of uncertainty just based around a payment reduction, which is absolutely fair. So, I think I heard it well when I was at HCAP, and Bill Dombey, which is the National Association of Home Care, the president of the National Association of Home Care. And, there was something to the effect of agencies aren't just going to shut their doors. They're going to have to figure out a different way to strategically provide care for those patients, in need. And unfortunately, I think, right now what we're seeing is kind of a group of individuals or, providers, and being home healthcare agencies, they're kind of sitting tight trying to figure out exactly what's about to come. And there's some good stuff that's in the works for patients as far as value-based purchasing and some of these other things that are going to be rolled out with the final rule, most likely from a value-based purchasing side. But really hope that CMS delays this any type of cut. And there's some litigation that's going on currently within the space to try to push that effort. But I would say, that's the really big thing right now that everybody's sitting and waiting on. And it really is, there's a lot of other stuff that's inside of the final rule, right? But I would say that's the big one right now that everybody's got their eyes on.
You mentioned how important education was too. And you've talked a little bit about how important educating the patient is. Obviously, you're working every day to educate providers and payers. How are you going about that education? How are you creating and distributing the education that's important to any community that you're working with, whether it's patient-focused, provider-focused, or payer-focused?
Yeah, that's a challenge in itself too, right? I mean, I think the long answer short is a lot of it is sitting down and actually just having conversations around what exactly it is that we're doing, how it works, what the capabilities are, where the different benefits are. Like I said, as far as like a mindset shift and change, it's really difficult to just send over a piece of content and then just change somebody's mind, or maybe I wouldn't even say change somebody's mind, but like turn the idea or the light bulb on of like, okay, there's this other idea out here that also could be effective. And here's the downstream effect of doing it of implementing something like this. So, a lot of it on that side is just having, consistent conversations with a lot of our different customers, prospects, people that we know within the industry. As far as like, we don't do too much with the payers at the current state, we work directly with the provider. And then our team's obviously engaging directly with those patients on behalf of the customer to get updates, provide additional information, and then get that information directly back over to our customers. So I think there's a lot that goes on there. I would let our director of clinical strategy speak to that more than myself.
Well, tell us more about TELUS Health Solutions, where you're partnering with these providers and these home health agencies to fill the gaps and to meet the needs of their patients while still staying in compliance with the rules that are coming down. How are you partnering with them?
Yeah, so we have a team of clinicians that when we partner with an organization, they're reaching out to patients in between visits to get updates that are important to clients. So they go through these different home health specific pathways. All of it's captured in real time inside of our software solutions. And then we have a client-facing software solution which delivers all that information and insights directly over to our clients. They can set up different alerts and tons of different things that they can do on their side to make the data actionable and go back and actually look and see where some of these different challenges are that, at the current state and time, they'd have to sift through all their visit notes or really dig in and see if, was this note copied from 2 weeks ago to today? Like, can I actually act on this? And really with the opportunity there is, to improve efficiency, improve the patient satisfaction side. They've got an additional 9 touch points throughout a 60-day period of somebody that's, clinically trained here in the United States, understands, the space, has worked in the space before, worked with patients in their home before, to be a voice, provide updates on how things are going with them. And then, like I said, that information is delivered back over to the customer for them to use and to be able to walk in at the next point of care with a little bit more focus and perspective of where that patient feels their progression is, helps out with some of the continuity of care as well.
How important is it to maintain flexibility with your solution? You and I have been in this long enough. We know it. Every provider is different. Every patient's different. How important is flexibility to telehealth solutions?
Yeah, there's not a one-size-fits-all solution, that's for sure. I've been saying that since I got into the space selling EMR back in 2015. I think there's a lot of companies in the graveyard, technology companies in the graveyard that built everything, around one way, right? And we've seen it a lot. So yeah, it's absolutely important to remain flexible. Different clients have different needs, have different patient populations. So everything that we look at on our side is absolutely built around being able to capture different different goals for customers. Some clients really need assistance on the patient satisfaction side, or somebody really needs different assistance in figuring out why patients are getting readmitted to the hospital, or going back to visit the ER. I mean, it all plays in tandem with each other at the end of the day. But it's flexibility within tech, and really just the operation and the process in which a client wants to take is a must.
Yeah, I couldn't agree more. And the flexibility, I think flexibility in healthcare is probably more important than any other industry, because we're dealing with people. We're dealing with patients, and their needs are different. There's, each episode is unique. We've talked a little bit about where we are, this early phase of adoption and implementation of value-based care and value-based reimbursement models. If you could look out into the future, maybe 10, 15 years down the road, when a lot of these kinks have been worked out and we're starting to work together and collaborate a little bit more completely between the patient, provider, and payer, where do you see us, 10, 15 years from now? What accomplishments will have been made by then?
Yeah. I mean, no crystal ball here or anything like that. But, I think if we're looking shorter term, it's probably going to get a little uglier as far as getting all of that mindset to be shifted. CMS has said on several different occasions they want, all of the reimbursements from Medicare to be tied to some sort of value, model by 2023. But, so that just kind of shows their commitment to pushing in that direction, just due to all of the other aspects of what's going on, from your growth of patient population, reduction of work, your increase in workforce shortage. So I would say, that's a really tough one to figure out, because there's so many different types of value-based care models, right? And so it really just would depend on the type of provider. I think in the space that we're working in, I think there's going to be some big opportunity longer term, but shorter term, it's definitely going to be a challenge to get everybody across that finish line, and making sure that things are what they were perceived, and then going back and fighting for things that aren't necessarily adding up, right? Because even though they're pushing, they're already in a value-based care model. I mean, there's always opportunity for improvement from all of the different stakeholders, whether it be the payer, the provider, or the patient. So just making sure that those needs and opportunities for improvement are constantly being evaluated. It's not just, all right, we got to a value-based care model now, it's good to go. They're just consistently looking at room for opportunity for improvement, and fighting for that opportunity for improvement, just because it's also new.
Yeah, there's going to be many iterations, and it'll continue to evolve as we go. And sometimes you have to take a step back to take 2 or 3 steps forward. And that's just, that's what happens typically in change or transition. If you could leave our listeners with one thing, maybe it's something you've already talked about, maybe it's something we haven't touched on yet. If you could share, if you could keep one thing at the top of our listeners' minds, what would that one thing be?
It would be that, home health is an extremely, extremely challenging space. So I think, our director of clinical strategy says it all the time. It's even speaking to others in the medical field, it's like speaking Spanish at times. And so I think there's got to be a focus, especially in our space, on not making it the ugly part of healthcare like it was so many times before, just due to some of the bad apples that brought, increased scrutiny. A lot of that's been cleaned up over the past several years, just due to regulation change and so forth. And just, got to get out and actually really promote these groups and make sure that they're taken care of, because they're caring for our highest risk patient population in their home, where those patients want to be cared for. I think that if there's one thing to leave it at, that would absolutely be it. Home health is extremely difficult. They do amazing work for our at-risk patients, and we definitely got to get out and support them.
Well said. Couldn't agree with you more there. I can't thank you enough for being on the show. It's always good to catch up with you. You guys are doing great things out there for a really important community within healthcare. And good luck to you. Thanks again.
Thanks, David. I appreciate it.